Hello, I am Dr. Son Young Hui from Good Dental Clinic. The case we'll be looking at today is a 71-year-old female patient. The patient already had implants at number 11, 13, and 21 in the maxilla and was wearing temporary prostheses. As you can see on the panoramic image, tooth number 23 had a crown root fracture with only the root remaining. So this was the preoperative situation with temporaries in place. On the CT, around the implants at number 13, 11, and 21, the labial bone appears to be almost completely lost. In particular, the implant at number 13 shows an incorrect angulation. If you look at the root remnant at number 23, the cortical bone is perforated at the apex, and the bone width is very narrow. This is the patient I demonstrated in a live surgery at the OSTEM meeting last year. Let's take a quick look. At that time, I placed many bone tacks and performed extensive GBR. As you can see, the implant at number 13 was removed, and labial augmentation grafting was done. The same was done at number 11. At number 23, the tooth was extracted, and implant placement using OneGuide was attempted, but primary stability was not achieved. So I performed GBR only and closed the site. After some time, it was time to place an implant at number 23. Since the existing implants are KS implants, I plan to use a KS implant at number 23 as well. Even after augmentation, the buccolingual bone width is very thin, so a regular diameter implant would be difficult to use. So for this site, I plan to place a 3.0 by 11.5 millimeter KS implant. As you can see, the bone around the previously placed implants is well maintained. At the number 23 site as well, there are no major issues with bone consolidation, and remodeling does not appear abnormal. In general, when placing an implant in this area, if we raise a flap and proceed with drilling, there can be a difference in resistance between the newly formed bone and the existing pristine bone. Because of this difference, the bone can chip off during drilling, which we encounter quite often. So I felt it would be better to avoid raising a flap if possible, and planned a flapless surgery using OneGuide. As you can see, using OneGuide, I plan to place a 3.0 by 11.5 millimeter implant. Some time had passed, as the patient lives far away and could not visit easily, which led to a delay in surgery. In fact, I think that after performing GBR, allowing a longer healing period is not a bad option. As you can see, the area around the number 11 implant is now covered with soft tissue, so I plan to uncover this as well. At the same time, I also plan to remove the bone tack in this area. The procedure itself was quite straightforward, but let's take a look together.
맞으세요? 네. 아프셔요?
자, 어떻게 보셨는지 모르겠습니다. 굉장히
I hope you found that helpful. It went by quite quickly, didn't it? There aren't many major precautions to note. In general, when placing longer implants, the one-guide drill is less prone to deviation than you might expect. So I don't think there's anything to be particularly concerned about. As shown here, I uncovered the healing abutment and placed the implant at the number 23 site. This is the post-operative panoramic image. On May 19, 2025, I delivered the final prosthesis. Custom abutments were used, and a one-unit restoration was fabricated. You can see the final result here. Here, I felt a bit uneasy. I wasn't sure if the abutment was properly fitted and seated correctly. The areas at number 13 and number 23 looked fine, but something didn't feel right here, so I took a radiograph. There were no major issues with the fit. As you can see here, these are CT views of the number 13, 11, and 23 sites. After explanting a failing or malpositioned implant, and in the setting of extremely limited available bone, achieving better results than this may not be easy. What I truly hope is that this outcome will remain stable for as long as possible. I expect a good long-term prognosis. I first saw this patient in May 2024, and treatment was completed in May 2025, exactly 1 year later. Now, the more challenging part remains, which is follow-up. I'll continue to follow this case closely, and hopefully be able to show you stable results in the future. That's all for today. I'll be back with an even better case next time.